Approximately 6 million Americans live with heart failure, and almost 900,000 new cases are diagnosed each year. But what is heart failure? What does this diagnosis mean? How will this affect my life? What medications do I need? How will I know if I need to see my doctor? What can I do at home? In this video, we will cover all of these questions and more. By the end, you'll have a much better understanding of what congestive heart failure is and how you can better manage going forward. So what is CHF? It stands for congestive heart failure and is a condition where the heart either doesn't fill up as well as it could or it doesn't pump as strongly as it could. As a result, not enough blood, oxygen, and nutrients are pumped out through the body to keep up with the body's demands. This leads to feeling tired and fatigued, feeling short of breath or having a cough, feeling nauseous, even confused or with difficulty thinking. To better understand why you experience these things, let's learn more about how the heart works. The heart is made up of 4 chambers, 2 on the right and 2 on the left. Used blood comes from the body to the right side of the heart, then it's pumped into the lungs to pick up oxygen. Blood comes back to the left side of the heart and gets pumped out to the rest of the body. It is this left ventricle which is most affected by heart failure. If the left ventricle can't fill with oxygenated blood or it can't pump that blood forward, fluid will back up into the lungs, into the legs, and even into the abdomen. 2 types of heart failure. 1, the heart muscle doesn't relax enough to fill with blood, causing fluid to back up in the legs. In the other, the heart doesn't pump enough blood with each heartbeat, causing fluid to back up into the lungs and leading to shortness of breath. The first type is called diastolic heart failure, or heart failure with preserved ejection fraction. The second is systolic heart failure, or heart failure with reduced ejection fraction. Ejection fraction? Great question. Ejection fraction is the amount of blood pumped out with each heartbeat. Normal is greater than 55%. If your heart pumps out less than 40%, this is considered a reduced ejection fraction. Your doctor will use this to monitor if your heart failure is getting better, worse, or staying the same. Ejection fraction is determined by an ultrasound of your heart called an echocardiogram, or just echo for short. The most common causes of heart failure include getting older, having clogged arteries, high blood pressure, smoking, and being overweight. Let's look at each of these causes a little more closely. By 40 years old, 1 in 5 people are at risk of developing heart failure. Having clogged arteries means the heart doesn't get enough blood. The heart muscle doesn't get enough oxygen or nutrients, and the heart can't work as well. If you have high blood pressure, your heart has to work even harder to pump blood against these high pressure pipes. Over time, your heart muscle gets too stiff and doesn't work properly. Smoking damages not only your lungs but also your blood vessels. This damage activates your body's immune system and puts you into a state of constant inflammation. Altogether, this damage causes your heart and lungs to have to work much harder and increases your risk for high blood pressure, diabetes, and clogged arteries. Being overweight places stress on all organs of the body. Obese people are 2 times more likely to have heart failure compared to people with a healthy weight. So now we know what causes heart failure, but how do we treat it? The good news is there are lots of ways to treat heart failure and to make your heart healthier and stronger. First step is to manage risk factors. These are things you have complete control over in your life. Things like losing weight, quitting smoking, making changes to your diet, and managing your other medical problems. Exercise is one of the most important steps to strengthen your heart and improve its function. Moderate exercise means getting your heart rate up for just 30 minutes and only 5 times per week. Each puff on a cigarette increases heart rate, blood pressure, and robs the body of oxygen. Quitting is one of the most important changes you can make to help your heart failure, but quitting takes patience and persistence. Making a quit smoking plan will increase your chances of success. Even if you are only kind of thinking about quitting, ask your doctor for help today. Making small diet changes like restricting the amount of fluid you drink or the amount of salt you eat each day can really help. Salt increases fluid retention, which increases blood pressure and puts a greater strain on the heart. Salt also increases fluid buildup, leading to swelling in the legs and feet, as well as shortness of breath. You should limit your sodium to no more than 2 grams per day. Keep in mind, 1 teaspoon of salt contains 2.3 grams of sodium. Limiting fluids each day is also important. Try to drink no more than 2 liters or 6 to 9 cups of fluid per day. This includes water, as well as coffee, juice, tea, or any other fluids. Managing your other medical problems will give your heart the best chance to get stronger. For example, if you have high blood pressure or diabetes, taking all your medications and working to keep these diseases well controlled will also keep your CHF well controlled. Taking your heart failure medications every day is also a very important part of managing CHF. Let's talk about a few of the commonly prescribed medications. Diuretics or water pills help get rid of extra fluid and salt, which makes it easier for your heart to pump. ACE inhibitors and ARBs. These work by relaxing blood vessels and lowering blood pressure. Beta blockers help the heart work easier. Spironolactone is another kind of water pill. ARNIs are a newer class of medication which combine an ARB with a medicine that helps to open the arteries. You should also weigh yourself at the same time every day and write it down. If you gain 2 pounds in one day or 4 pounds in 1 week, call your doctor. Also, you should see your cardiologist at least every 3 to 6 months. Let's summarize. CHF stands for congestive heart failure. It means the heart doesn't relax enough to fill, or it doesn't pump enough with each heartbeat, and causes fluid to build up throughout the body. Ejection fraction is the percentage of blood pumped out with each heartbeat. Normal is greater than 55%. Common causes include age, clogged arteries, high blood pressure, smoking, and being overweight. Getting 30 minutes of exercise 5 times a week is really important. Limit sodium to 2 grams per day and limit fluid intake to 2 liters or 6 to 9 cups per day. Eating too much salt increases fluid in the body. Also, make sure to take all your medications every day and weigh yourself at the same time every day. If you've gained weight, call your doctor. And finally, make sure to see your cardiologist at least every 3 to 6 months. Hopefully now you understand more about CHF and what you can do at home to help. If you have any questions, make sure to ask your healthcare team today.